We are live, sir.
Okay, so hi, evening friends, evening everybody, bache, evening everybody. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hemato-Oncology, AIMS Delhi. And let us start with our MDS Pathology and Microbiology recall session. Now, before I even go further, let me just check if everything is working fine and the link is working well. Yes, it is. It is. So, bache, let us start. Let us start with our today's session. Now, the whole purpose of this session is not to give you any anxiety with respect to कि whether you marked it right or wrong. Not at all. जो mark कर चुके हो वो mark कर चुके हो. इस time पर tension नहीं लेना है. This session will obviously help you in knowing कि whether you marked it right or wrong firstly, and especially for the juniors because the topics are often repeated. With respect to path and micro, this time in the paper, we had comparatively lesser number of questions from path and micro. Overall, medical subjects के questions come थे. There were lesser number of questions from medical subjects. Dental subjects had much more weightage in this paper than is usual in the NEET MDS exam. So let us start. Let us start with our first question. And I want all of you to keep on telling me the answers side by side. This is a very interactive session, so do not hesitate to say the answers firstly. Secondly, in case of any doubts, please do write it in the chat box. So let's start. Let's start with our first question. Which of the following is the most common fungal organism responsible for community acquired catheter-induced urinary tract infections or blood-borne infections? So the examiner is talking of catheter-induced urinary tract infections. देखो बच्चे, when we talk of catheter-induced UTIs, when we talk of catheter-induced UTIs, the most common that comes to our mind is E. coli, followed by Pseudomonas species. E. coli, Pseudomonas species, Enterococcus, Staph, Staphylococcus, Staph, and cons, that is coagulase negative staph. These are the main bacterial infections that come to our mind when we talk of catheter-induced urinary tract infections, followed by, of course, yeast. In our question, all the options that were given were of the yeast. So I'm pretty sure that majority of us would have marked Candida only. Isme you would not have gone for Histoplasmosis, Trichiton, or Rhinosporidium at all. I'm sure of that. For the juniors, if you're asked the bacterial infections associated with catheter-induced UTIs, E. coli, Pseudomonas, Enterococcus, staph, and cons, that is coagulase negative staph, versus catheter-related blood-borne diseases or bloodstream infections is mainly by gram-positive bacteria. It is mainly by gram-positive bacteria. Staph, cons, coagulase negative staph, main being staph, Staph aureus, coagulase negative staph, and Enterococcus. This is with respect to community acquired catheter related bloodstream infections. So in our question the option was straightforward, Candida. हम लोग बाकी चीजों का तो सोचेंगे भी नहीं. Next question, a young girl comes with multiple draining sinuses with matted lymphadenopathy. The minute we have history of multiple draining sinuses with matted lymphadenopathy, TB. In cases of TB, the lymph nodes are matted. They are multiple form matted lymph nodes seen in TB. TB is again a topic which is repeatedly asked. Commonly asked topic, the giant cell seen in TB being Langerhans giant cell, along with caseous necrosis and granulomas. Another question that is asked is non-caseating granulomas with bilateral hyalulymphadenopathy, sarcoidosis. You know that set. Next, bacteria associated with gas gangrene. I need not even talk about gas gangrene. I am pretty sure that you are comfortable with this. Acha Danish, bache, first before we go back, bacteria associated with gas gangrene is of course Clostridium perfringens. Next, so let me come back to this question. So you are telling me that the options were slightly different. See, that is the whole purpose of recall. If Cons was in the option, Danish, if coagulase negative staff. See, when we talk of the MBBS exam, I personally go and give the paper so that we are able to have a good recall. But in this case, we had, of course, students, and I have asked the recall from them. So, in case there is any difference in the option, please do not hesitate to tell me right here. Those if cons, coagulase negative staph is among the options for community acquired catheter induced urinary tract or bloodborne infections. In that case, that becomes the best answer. And actually, thanks that you told me this. Others, which do chip in, do give me a thumbs up or like the session in case you are comfortable with ki, haan, these are the options. Next, because of course, you know the options better. Next, stellate granulomas. Whenever we talk of stellate granuloma, cat scratch disease, there are two named granulomas. Dark granulomas, dark granuloma that is seen in malaria, Plasmodium falciparum, versus stellate granulomas associated with cat scratch disease. Next question. Next, winter bottom sign and sleeping sickness. Which is winter bottom sign? It is swelling of the lymph nodes of the posterior cervical region. The lymph nodes of the posterior cervical lesion, they are swollen, especially in early cases of African sleeping sickness. That is winter bottom sign. Sleeping sickness and bottom where the patient is lying down with head on his pillow. So the head is on the pillow, it is at the bottom. That is the winter bottom sign seen in early cases of sleeping sickness. The posterior cervical lymphadenopathy is seen in that case. Next question. Next question. Let us have a look at now, that was a different question. NEET MDS mission. Okay, so I guess we are having. Do tell me either in the chat options or in the comment. There is some confusion with respect to that catheter-induced UTI question. If catheter-induced urinary tract infections or bloodstream-induced infections, in that case, if the options that I wrote were correct, the best answer was Candida. If cons, coagulase negative staph was in the options, or even if it was a different question, if coagulase negative staph was in the options for that, that is the best answer. Now, there was another question of coagulase negative staph. Sorum and NEET MDS mission, bache, I guess that is what you are talking of. Before I go to patient with simian crease, I'm sure all of us know patient with simian crease is a case of Down syndrome. It is a case of Down syndrome, trisomy 21. There was another question. Yes, Karan agreed. There was a question in which patient had serious abnormalities with prosthetic heart valves, NEET MDS. Perfectly agreed. It was a case of question was asked on prosthetic heart valves, and the examiner had asked you early prosthetic heart valve, that is less than 1 year. Most common organism associated is cons, coagulase negative staph. That question was also there. सो हाँ, कोई बात नहीं, अरे सॉरी, कुछ कंफ्यूजन और सॉरी तो बोलना ही नहीं है दोस्त इस टाइम लाइफ में. मतलब तुम समझो यार, मैं तुम्हें कैसे बताऊं. दिस इज अ सेशन नॉट ओनली टू डिस्कस द क्वेश्चंस. This is a session in which we chat with you also. I wanted to talk with you actually since long because the paper has been done. And how are you guys? I actually wanted to ask you that also. आई नो कि पेपर का एंग्जाइटी है, पेपर का एंग्जाइटी से ज्यादा इस टाइम पे रिजल्ट का एंग्जाइटी है. सीट्स आर लेस एंड यस इट इज एन इम्पॉर्टेंट पेपर, बट at this point many new seats have also come up. I am sure, I know I'm slightly digressing from the topic, but maids में seats निकली हैं. Few of my closest friends are in the dental segment and some of them are of the opinion कि हम नहीं देंगे पेपर, या you know, slight slight bias will be there against outside Delhiites. देखो दोस्त, मुझे ये पता है कि अगर हम पेपर देंगे तो चांसेस ऑफ सिलेक्शन आर लेस, बट अगर हम पेपर नहीं देंगे, इन दैट केस द चांसेस ऑफ सिलेक्शन आर जीरो. सो ऑलवेज गैम्बल ऑन योरसेल्फ. Give exams. The result will सरप्राइज ऑल ऑफ अस. जब तक हम कोशिश नहीं करेंगे ना सेलेक्ट होने की, तब तक कैसे होंगे. सो गिव एग्जाम्स. Another Rajasthan has also launched, I'm not aware of the number, but close to 180 seats have come up. I'm saying this for the students who are eligible, that is, who have given the paper this time. So, bache, things are going to work out extremely well. डरना नहीं है, घबराना नहीं है. Things are going to work out well. And of course, INI is coming up. INI is coming up. So, अभी तो होली का टाइम है. All of us are relaxed. हम लोगों की ना पढ़ने की हालत भी नहीं है. We are in the slight post exams phase. So after that, we'll start from 1st April and start preparing again and see कि क्या करना है. Next question, coming back to this. Now, अच्छा, before we go further, मुझे ये भी बता दो, इसमें was it written that it was a patient with simian crease या a small child with epicanthic folds, flat facial profile with a transverse simian crease was given? जो भी है, it was a case of Down syndrome, which is trisomy 21. You know that. Next, again, a favorite question of the examiner. Patient blood was withdrawn and kept in a vial containing fluoride. That is gray top. Gray top. G for gray, G for glucose estimation. Favorite topic, favorite question. Glucose estimation is done in vial with gray top. Gray top, it contains potassium oxalate. Glucose estimation, which is the anticoagulant used, that is potassium oxalate. This is the anticoagulant along with fluoride, along with sodium fluoride. Fluoride inhibits the enzyme enolase. Fluoride inhibits enolase. Next question. Next question. Epicanthic folds with the simian crease. Agreed, those agreed. Next, which of these would you perform before surgery in a patient who is on warfarin therapy? A patient who is on warfarin, we always want to check PT-INR. देखो बच्चे, even if you might or might, this is an overlap question between path and pharma. BTCT, bleeding time, clotting time, are obsolete tests. They are not performed now at all. So never mark any answer as BTCT. Platelet count does not decide. So which is used to monitor warfarin therapy? That is INR, International Normalized Ratio. The best answer would have been PT-INR. If PT and INR were given in separate options, then too the best answer is INR, International Normalized Ratio. Next question. Next question. A young male came with COVID-19 infection. Now, frankly speaking, I was slightly astonished to see that there was a question on COVID-19. लेकिन ये तो सबको पता है कि histopath showed he had some reserve maxilla and something. Histopath showed the presence of both septate and aseptate hyphae. All of us know that aspergillosis shows the presence of acute branching septate hyphae. So, when we are talking of COVID-19 infection, the answer becomes mucormycosis. Aspergillus has acute branching hyphae. So, it was a case of mucormycosis. Next question. Acha, before I go further, I want all of you to tell me ki all the questions that we have discussed till now. Path and micro, the total number of questions were about 14. They were not much this time. I'm going to the next one, like McConkey's media. It is a differential media. A simple, straightforward question. You very well know that differential media, it helps in differentiating between organisms. That is the lactose fermenters versus non-lactose fermenters. Lactose fermenters are pink, non-lactose fermenters are colorless or pale colonies. So McConkey's media is a differential media. Overall, before I go further, how was your path and micro? It is not only about knowing these topics or knowing these questions. अभी तक अपने कितने गलत हुए या how was it? How was it? नहीं बच्चे, अनम, mucormycosis is predominantly aseptate, but it has thinly branched septate hyphae also. So, wise answer, not mucor and aspergillus. Abhiram, I'll go back to this question. Anam and Abhiram. Yes, you're right. The question says both septate and aseptate. Agreed. Agreed. It shows both septate and aseptate. Now, aspergillosis only has acute branching septate hyphae, which is this is aspergillus. It only has acute branching septate hyphae. Versus mucormycosis. नहीं बच्चे नहीं, अभिरामी नहीं. I'm telling you the right answer. I mean, there's absolutely no confusion about it. The answer is not Both. Answer is not both. The answer is, I didn't get you. The answer is mucor. This is because mucormycosis has predominantly aseptate with thinly septate hypha. That is the best answer, mucormycosis. It is not both aspergillus and mucor. Next, next question. मेरे दोस्त, I agree that there is extensive involvement of maxilla. कहीं पे reserve, I don't know what reserve maxilla meant. Extensive involvement of maxilla, I agree. But इसमें जो main word था ना, that was the presence of both septate and aseptate, making the answer as mucor. Take my word on it. अच्छा, इसको ऐसे करते हैं कि let me use my veto power on this. Let the answer be mucor. Next question. Next question. Now, this was one question that was, I'm saying it very frankly, that was out of what I had taught in the class. This was the only question that was not covered in the syllabus. Co-aggregation. Co-aggregation. What do we mean by co-aggregation? It is a process by which genetically distinct bacteria become attached to one another by specific molecules. They are co-aggregating. The genetically distinct bacteria, they are co-aggregating with each other. It is a feature of gram-positive bacilli. It is seen between gram-positive bacilli. I don't know why. I mean, you can say it is, sir, it is easier for you to sit on this side and say it. But if I was in your place in the paper also, I would have marked it as gram-positive bacilli. So I am actually concerned about this question. How many of you, how many of you marked it as gram-positive? Please do tell me, because that was a question. It was endodontic micro. Okay, fair enough, fair enough. Next question. Shreya, you will realize what is veto power when you get power. With great power comes great responsibility. And for the others, Shreya is a close friend, so she is just teasing me. Next, HIV associated pneumonia. I do not have the options, but the right answer. So again, please do tell me if this was given. The most common cause of HIV associated pneumonia is Pneumocystis jirovecii. It is Pneumocystis jirovecii. This was a recent repeat MDS PYQ. Next, gram positive. Perfect, perfect. No, yaar, gram negative bacteria do not show co-aggregation. Co-aggregation is a feature of gram positive. Gram positive. So, Pneumocystis jirovecii, puncti, totally agreed here. If was in the options, the most common cause of HIV-associated pneumonia, Pneumocystis jirovecii. Next question. Next question. Patient presenting with community-acquired pneumonia, having cough, fever, pleuritic chest pain, and shortness of breath. When we talk of fever, chest pain, shortness of breath, three main organisms come to our mind. Most common cause of community-acquired pneumonia. Most common cause, strep pneumonia. Most common cause being strep pneumonia. No double meaning talk, waste time. So if strep pneumonia was in the options, that is the best answer, followed by Staph aureus and Haemophilus influenzae. These are the three main causes of community-acquired pneumonia. So this takes care. So if the 15th question was with respect to that prosthetic heart valves, where the answer, early prosthetic heart valves, where the answer was cons. Coagulase, negative staph. That is staph epidermidis. Staph epidermidis, though, was not given in the options. The answer to be marked was cons. Coagulase, negative staph. So these were the 14, 15 questions that were asked. A lot of stress was given on lungs, that is pneumonia and the organisms associated. Firstly, next point, next, do not worry. Whatever we have marked, we have marked. Is time pe we cannot change our answers. We cannot do anything about it, but we can certainly work for the future. So at this point, we can actually do two things. We can either wait for the NEET result, either we can wait, go on a trip or something, but I'm pretty sure that इस time पे ना हम लोगों का ज्यादा कुछ ऐसा मन कर नहीं रहा है. I mean, I can certainly relate to that thought process. Many of you have already joined clinics. I mean, have rejoined the clinics. You are working either under somebody, you have joined a trust hospital, or are thinking of setting up your own clinic. Certainly a good choice. मतलब इसमें there is no doubt. It's fully in support. While the second subset of students who want to restart, and when I am saying restart, I am certainly not meaning for the NEET exam. One thing is certain, I mean, I love you guys enough to say this from the bottom of my heart. I don't want to see you ever again as my students for the dental class again. Never ever again. Yes, we can meet for the INI sessions. We'll be launching the INI sessions, the grant test series, and everything. We can certainly restart for INI, or you can study for the maids exam that is coming up, or for the Rajasthan seats that are about 180 200. More states will open up seats. So one thing is certain, future is bright. This was just a stupid paper which in no way is going to decide how successful you are going to be. Yes, it is going to give you a huge push. It's going to give your career a huge push. There is no doubt about it. Panki bache, whichever was the difference in the question, please do write it in the comment section, and I'll take care of it. But this was the recall that I got, so I had put it. Certainly, two, three options that you had changed. Uh, but doesn't matter. But one thing is certain, or touchwood, all of us are from good families where we do good things in life and we are going to have a bright future ahead. So there is no right thing or wrong thing to do. There is absolutely no right answer to that. You can either wait, that is also perfectly okay. I mean, it's not that students who are waiting are doing right or wrong. You can go on a trip, anything to keep you distracted. You can join a clinic, or you can restart. For those of you who are for the juniors, of course, the advanced plan that has all the videos and everything. The videos are there, the pre-recorded videos and stuff, along with an extensive question bank and test series. For the students who are giving the INI exam, Asha, with respect to hard copy of the notes, I'm again saying this. There is no substitute. This is, of course, for the fresh interns. For the fresh interns who will be giving the NEET MDS exam in 2025, which will make your own set of notes. Yes, we are giving you the hard copy of the notes. Use them just as a reference point, or use them around if you start your preparation at a later point, October, November. But there is no substitute for making your own notes. So make your own notes also. And of course, the revision series with everything. All said and done. All said and done. Our next exam is the INA exam. Let's keep our fingers crossed for that too. So take care. And we are in this journey together. Shreya Bachit, tumhi ne bataya. I know you. So come back, come back. And one thing is certain, that we are in this journey together. So do tell me how it goes. We will be in touch, and bestest of luck for the papers. Thank you. Thank you, and take care.